On the lecture 14, we're going to talk about infections of the digestive system. Our gastrointestinal system is composed of alimentary tract and associated organs. Alimentary tract is a tube-like structure that extends from the mouth to anus. And alimentary tract consists of oral cavity, pharynx, esophagus, small and large intestine. And associated organs are teeth, tongue, salivary glands, liver, gallbladder, and pancreas. Please remember, the last four, including salivary glands, are essentially sterile. Our digestive system is partially mechanical and also chemical. Example of mechanical part of our gastrointestinal system will be chewing and the peristalsis or bowel movement. Example of chemical part of digestive system will be enzymes in our saliva, stomach acid, and bile salts. And the first infection we are going to start with is caries or cavities. But before we start talking about caries, let's look at the structure of our tooth. So the most outer layer of our tooth, on this picture it's kind of pinkish color, is what we call enamel. This is the hardest part of our tooth. And then if you look here closer, there's a purple part. This is what we call dentin, and dentin not as hard as enamel. And then in the center you see dark blue, you see pulp, and this is where nerve endings are located. Now, each tooth in our mouth has its own place. It sits in what we call bone socket. And there are certain tissues that keep our teeth in their own bone sockets, and those are periodontal ligaments and gums. That is the supportive tissue for each tooth. So, caries. Caries is a modern infection because ancient people didn't know about caries. Humans started having this problem once they started using sucrose or table sugar in their diet. The cause of caries is Streptococcus mutans, which is gram-positive coccus in chains. And the reason why it causes caries because it can metabolize sucrose. When Streptococcus mutans metabolizes sucrose, it produces glucan, which is a mesh-like structure that has ability to attach to the surface of the enamel, and this is actually what dental plaque is made of. So basically, the dental plaque that can be found on the surface of our enamel is made of glucan, bacteria, and debris. Also, when Streptococcus mutans metabolizes sucrose, it also produces lactic acid, and this is what actually causes damage of the enamel. Please remember that some people are more caries prone than other, and I believe it's related to the absence or absence of certain enzymes in saliva. But also studies show that children who acquire strep mutants before the age of 2 have 8 times as many caries as children who acquire it after 4. What does it say to us? It means adults not supposed to share spoons, cups with the small children, because this way they actually introduce strep mutants into the young children's mouth. How can we treat this problem? Of course, it's easier to prevent caries, and we prevent it by regular cleaning of the teeth, flossing, toothbrushing. But if cavities are already developed, then we have to fill them out. The next dental problem is what we call periodontal disease or periodontitis. Periodontitis means damage or inflammation of periodontal um, tissues. And periodontal tissues, those are periodontal ligaments, bone sockets, and gingiva or gums. So the problem begins when a plaque is formed on the surface of the teeth. The most dangerous location of the plaque in the pockets between gum and the tooth. So the first stage of periodontitis will be what we call gingivitis. It's inflammation of the gums. On this slide, there are the main symptoms of gingivitis, which are redness, swelling, and bleeding. But guys, keep in mind, those are symptoms of advanced gingivitis. If you, for example, brush your teeth and you see some blood in the water, that means you already have first signs of gingivitis. If gingivitis is not treated, infection or inflammation goes deeper and affects periodontal ligaments, bone socket, and then patients develop what we call periodontitis. Today, it's a leading cause of tooth loss, and it is actually caused by bacterium. It's called Parphyromonas gingivalis. Parphyromonas gingivalis. The source of infection will be infected individual, transmitted through direct contact or through the fomites, cups, spoons that contain infected saliva. Same as the previous dental disorder, periodontitis is much easier to prevent than to cure. To prevent this infection, we have to have regular teeth cleaning. We have to remove plaques from the surface of the teeth. Regular brushing, flossing also will prevent periodontal disease. And as I said, periodontitis is very difficult to cure. We can use antibiotics systemically. We also use antibiotics locally. We apply them on the surface of the gums. But unfortunately, even with the best treatment, with the strongest antibiotics, eventually those patients lose their teeth. Next is a viral infection. It's a viral infection, systemic viral infection, mumps. And mumps is caused by mumps virus. It belongs to Paramyxa virus family. Infects humans only. It means humans are the only reservoir. Infection is transmitted by respiratory droplets or fomites. And this virus usually affects salivary glands from one side or from both. And we call it parotitis. As I said, mumps is transmitted by respiratory droplets. Incubation period about 2-3 weeks. And after those 2-3 weeks of incubation period, patients will develop symptoms of upper respiratory tract infection, which are headache, muscle aches, fever, conjunctivitis, runny nose. And then this virus spreads into salivary glands, and this is when they become enlarged and tender. As I said, infection can affect one side of salivary glands or both. And then we call it bilateral parotitis. There are certain complications that those patients might develop. Orchitis is the first one. It is painful inflammation of the testes, and actually it can lead to sterility. Also, this virus can cause damage of their inner ear. As a result, patients might develop deafness. Also, pancreas and thyroid glands can be infected, and then it causes inflammation of those organs. And eventually, the most dangerous complication that those patients might develop will be damage of the nervous system. When this virus affects a nervous system, patients develop severe headaches, loss of balance, and symptoms of brain damage. There's no specific treatment since it's a viral infection. Treatment is going to be symptomatic. Vaccine is available today. It is a part of MMR vaccine. We continue our lecture with bacterial infections of gastrointestinal tract. And we start with shigellosis. Shigellosis is also known as bacillary dysentery, and it is caused by Shigella species. Shigella species are gram-negative bacilli with pili. The pathogens are very contagious. As you see, it requires only 200 cells to get infected and develop symptoms. And usually this infection affects children, young children. The source of infection will be infected individual or contaminated food. And the main symptoms that patients usually develop will be abdominal pain, diarrhea, and very often we can see some blood in the stool of those patients because Shigella species can cause damage of the blood vessels of the intestinal tract. Most of the times, infection is self-limiting. That means we're not going to use antibiotics for treatment. And the reason why, because remember on the previous lectures I told you, we have a lot of different bacteria living in our GI tract. And if we use antibacterial drugs to treat those infections, then as soon as one of those bacteria becomes resistant to that antibiotic, the rest of the bacteria can become resistant as well, including pathogens. So basically, if infection, GI tract infection, is not life-threatening, then we prefer do not use antibiotics for treatment. Typhoid fever is a next systemic infection, and it is caused by a Salmonella typhi. It is gram-negative bacillus with flagella. And on the previous lecture, we talked about typhus. And typhus as an infection is caused by Rickettsia species. Guys, please don't get confused. Right now we're talking about typhoid fever. And typhoid fever is caused by Salmonella typhi. Salmonella typhi infects humans only. The source of infection will be infected individual or carrier, or contaminated food or water. Infection is transmitted fecal-oral by fecal-oral route or direct contact. Infection is systemic, and as you see, patients stay ill or sick for about a month. And the symptoms of infection will be severe intoxication, high fever, severe headache. Patients become confused, weak. They have severe abdominal pain and very specific rash on the surface of the skin. We call it rose spots or faint rash. Mortality rate for typhoid fever is about 10%, which is pretty high. And of course, for this infection, for treatment of this infection, we're going to use antibiotics because, as I said, typhoid fever can be a life-threatening infection. As a drug of choice, we can use chloramphenicol. And you probably remember from previous lecture, it is one of those antibiotics that have very not pleasant side effect that can cause aplastic anemia, but still we use this antibiotic to treat typhoid fever because, as I said, typhoid fever is a life-threatening infection. 3% of patients that recovered from typhoid fever will become chronic carriers. And all carriers of typhoid fever must be registered in the local public health department. And today, those patients are not allowed to work in the food industry or with children. Next infection is Salmonellosis, and it is caused by Salmonella species, which are gram-negative bacilli. Salmonella species have pili that they use for attachment, and Salmonella species infect animals and humans. Even though here on this slide it says that salmonellosis is a food poisoning, but guys, please remember, salmonellosis is what we call true infection. The source of infection will be birds, for example, chicken, turkey, and the reason why, because for chicken and turkey, salmonella species are part of normal biota in their GI tract. Also, source of infection, of course, can be infected individual. How usually people get infected? People usually get infected when they do not follow certain rules when they cook poultry. Symptoms of the infection will be abdominal pain, fever, diarrhea. It is another self-limiting infection that lasts usually about 3-5 days, and usually most patients recover from this infection without any additional treatment. Escherichia coli is next bacterium, and we've been talking about Escherichia coli since beginning of semester, and I told you that E. coli is a part of normal biota of humans' GI tract, and it is what we call coliform. But there are some virulent strains as well that actually can cause GI tract infections in humans. A few of those strains are listed on this slide. The first one is enteroinvasive strains, and as you see, they cause diarrhea in all ages. Enteropathogenic strains, they usually cause diarrhea in newborns and infants. The next one is called enteroaggregative strains. They usually cause chronic diarrhea in children and infants. Next one is what we call enterotoxigenic strains. Enterotoxigenic strains usually cause what we call traveler's diarrhea. And if you travel somewhere, eat something contaminated or drink contaminated water, usually in a couple days you will develop diarrhea, abdominal pain. Usually it is a self-limiting infection, and patients recover within 3-5 days. But your attention I would like to pay on the last strain, pathogenic strain. It is called enterohemorrhagic strains, or E. coli 0157H7. The reason why I would like to pay attention on this strain, because this pathogen can cause very severe life-threatening complication. It's called hemolytic uremic syndrome. The main symptoms of hemolytic uremic syndrome are bloody diarrhea, severe anemia, and kidney failure. The causative agent of this problem will be toxin that is produced by enterohemorrhagic strains of E. coli. And you have to remember, if patients develop symptoms of hemolytic uremic syndrome, there is no specific treatment for this complication. The source of this infection usually undercooked hamburgers.